So I will present you our recent publication, and also I will add some discussion on the relationship between COVID-19 and HPV testing on behalf of my co-authors, Kate Kusheri, Nayab Bahed, Mark Bay, and Alex Wosters. So I have no conflict of interest to declare. Otherwise, I am the head of the laboratory that performs HPV and COVID-19 molecular testing. So this is my only conflict of interest. So as you know, there are three pillars. WHO is promoting to eliminate the cervical cancer, and until 2030, if we focus on the second pillar, if we would like to reach the vision and the goal of elimination until 2030, we need to screen using a high performance test each woman, 70% of all women in the world, twice in age of 35 and then in age of 45. However, Natalie said several times that the global HPV test supply needed to reach this 70% screening coverage for elimination is estimated to be in the range of 1.4 to 1.5 billion HPV tests in 5 years. So we need this number of the tests in the 5 years to reach the target for elimination. And I think we are far away from this capacity. So the first reason was the pre-COVID problems. As you know, there are many tests on the market, and we are following all these tests very tightly. And you see here summarized, 60% of all HPV tests on the market are without any single peer review publication, 80% without any published analytical or clinical evaluation in peer review journals, and only 10% actually of the test which on the market has some publications concerning the clinical validation for the cervical cancer screening. So we have no much tests actually which are clinically validated for the screening. On top of this, as you know, for majority of the countries in the world, if they want to perform screening, they need the WHO pre-qualification. So this is the procedure in which WHO actually pre-qualified in vitro diagnostics for high burden diseases. And out of 200 plus tests which are on the market, unfortunately, only 3 tests for HPV-based screening have been WHO pre-qualified. So to conclusion of the pre-COVID time, there's still a relatively small pool of HPV tests that fulfill both operational and performance characteristics required to meet the global screening challenge toward elimination of the cervical cancer screening. And then last year in January, COVID-19 related problems arise on top of all other pre-COVID problems. So as you know, we have unprecedented health and economical impact of the COVID pandemic, which produce extraordinary demand on the global scale for everything which we need for the testing, from sampling devices, reagents, consumables, diagnostic instruments, and also the manufacturers actually completely shifted toward the new niche market with a high growth opportunity. And this related to serious COVID-19 related supply chain problems. And also we had already pre-existing problems across the world with the shortage of the high quality staff in microbiological laboratories, especially in the United States. So the only survey we can identify before our study was this one published by American Society for Microbiology. So this is the largest society in the world dealing with microbiology, not only with the clinical microbiology, but microbiology in global. And you see here, they sent the survey around the different CLIA certificate labs. And the response was actually that because of the supply constraints, the labs which would like to perform more COVID testing were unable to perform, and majority of the laboratories actually worked on the 40% testing capacity for COVID-19. So 73% of laboratories reported a shortage of commercial testing kits for SARS. 70% reported shortage of supplies for other infections, molecular detection of other infectious diseases, including sexually transmitted infection, and so also including HPV. And actually 65% of labs reported shortage also of non-COVID testing supplies, and also in bacteriology and in fungal testing, although it's not really directly correlated with SARS-CoV-2. So this is why actually COVID, our HPV Prevention and Control Board react soon. As you know, just to summarize, in August 2020, we had a meeting where we for the first time discussed challenges in the HPV-based cervical cancer screening landscape, which also include for the first time session on the impact of COVID-19 on HPV-based screening and screening programs based also on cytology. Then we actually organized a special 2-day meeting in November 2020, technical meeting, which was fully devoted to the impact of COVID-19. And for the first time at this meeting, we actually discussed very deeply about all the problems and which COVID-19 caused on the HPV elimination or cervical cancer elimination goal, affected not only vaccination, HPV vaccination, but also HPV screening, both cytology-based and HPV-based. And since all this, although we are experts in the field, what we reported during this November meeting was actually based on our anecdotal experience or experience of our colleagues. This is why actually we agreed in our board to maybe produce a short, brief survey and try to figure out is there really problems and if really COVID-19 testing affected also HPV-based testing. So the purpose of the survey was to acquire real-life insight into the impact of the SARS-CoV on potential shortage of the test equipment and consumables and staff, specifically to the HPV-specific laboratory procedures. We would like also to understand not only negative impact of COVID, but also to collect some ideas about opportunities which are rising from out of the COVID. And on top of contacting our colleagues, which are working in the laboratories worldwide, we also contacted 5 major manufacturers of the clinically validated HPV test, just to ask them about their plans to mitigate current and future pressures on demand for molecular testing. And the survey actually was online questionnaire, which contained of 19 items, mostly multiple choice, but there was also room to provide additional free text comments. We tested this questionnaire in the small pilot, and then we actually opened the questionnaire, and we targeted actually laboratory managers with responses limited to the one laboratory. We disseminate a questionnaire through the International Papillomavirus Society members among the labs which participate in the largest quality assurance HPV-related proficiency panel in 2018 and 20. And we also include this notice about the questionnaire in the ESMID newsletter, which is sent usually on around 30,000 plus emails. And we opened this survey from 21st of December 2020 to the 2nd February 2021. As I said, we would like to accompany also the response from the lab directors, also from industry. And this is why actually we contacted the 5 companies, Abbott, Becton Dickinson, Cepheid, Hologic, and Roche, the companies which are offering both HPV validated products and also COVID-19 validated products, and we asked them about the support for the emerging need on national and global level, on recent investment in manufacture capacity, on the safeguards and commitments to manufacture other molecular diagnostic assays, non-COVID assays, including HPV tests, and about the current and post-pandemic strategy for HPV tests. So we received a response from the 57 laboratories from 30 countries across the 6 continents. And you see here marked in blue, these are the countries from which we received at least one answer to the questionnaire. So we excluded 8 laboratories who had provided only incomplete data, and 3 responses are coming from laboratories which are not performing HPV tests. And finally, we analyzed 46 different laboratories across the world. And you can see here, so there are different kinds of laboratories. Some laboratories just focusing on HPV, but majority of them were actually the general molecular laboratories also offering HPV testing. So this is the response which we received from these laboratories. So these are we asked specifically about the shortage of specific consumables during the COVID-19 pandemic. And you can see here the majority of the laboratories have a problem. The major problem was actually extraction, DNA, RNA extraction reagents, which we usually used for in molecular microbiology. So instead of using for HPV, they was forced to use for SARS-CoV diagnostics. There was also shortage of the PCR reagents, shortage of the plasticware, which is universal laboratory equipment. It was also shortage in the collection and transport media, especially in the beginning of pandemic. We were forced actually to use all kind of transport and collection media, which we have also for the SARS-CoV diagnostics, even those originally developed for HPV actually. And there is also problems with personal protective equipment, especially during the first wave. Even the molecular grade fluids, ethanol, general disinfectants. So there is several problems actually recorded. So there is also a problem with the laboratory staff because of the pandemic. There was a shift of the staff, which usually is performing HPV test to the COVID-19 testing laboratories. So as you see here, around half of the laboratories replied that they have a problem with the shortage of the staff because some staff was actually co-opted to support COVID-19 testing, or not all staff was allowed to work at the same time. So then some laboratories actually decide to keep 1/3 of the laboratory on hold, just on the case if something happened, that they have always a backup solution. Then we ask, was the time to receive HPV tests prolonged during the COVID-19 pandemic? Half said no, and half reported that even 21 quarter reported there was more than 1 month actually prolonged results for the HPV results according to baseline because of the COVID-19 pandemic. Then we ask about impact of the COVID on HPV testing. You see that majority reported the impact, which is quite long, even third longer than 1 year. As we know that majority reported there was a suspension of the routine cervical cancer screening because of the COVID. And also, which is very interesting, majority of the people actually who worked as a researcher in HPV field temporarily actually stopped and switched working on COVID, also in science. And you see that the great majority of the people actually saw clearly low capacity in research activities. So then I will summarize here response from the companies. I think these are very, very valuable data, not very well accessible. So the 4 companies provided a statement in response to our questions. All companies expressed a commitment to being in front line to support the COVID testing, which we expected. Which is very interesting that all companies actually described substantial growth in diagnostic activity in business. 2 companies specifically said that the growth in sales was around 100%, mainly driven by COVID test. And all companies described the substantial increase in manufacturing capabilities. So for example, one company reported that in average, pre-pandemic, they release and launch 5 microbiological assays per year, where in 2021, they anticipate launch of the 17 assays, including the molecular antigen serology assays. They report doubling of PCR capacity in 21 and even tripling in end of 21, One company described a significant increase in manufacture capability. You see they add 60 new manufacturing lines for consumables, 70 new locations, 20 new manufacturing lines for reagents, along with the 4 major facility expansions and new manufacturing space for instruments. And also some of them, they said they now dispersed manufacturing capabilities around the world just to cope with the regional need. There is also acknowledgement that recent scale up and development because of COVID will have most probably the long-term positive consequences for the molecular diagnostics in general terms. 2 companies explicitly said that this will also have a very huge positive consequences and will support the HPV testing in time. And also 2 companies said very clearly that we will have multi-million investment in manufacturing facilities. They will actually safeguard not only a supply for the SARS-CoV assays, but also for a molecular diagnostic assays, and both said also for HPV assays. So there's, however, caveats and limitations of our survey. We had a limited response, although we received actually the response from covering all continents. It's always possible in questionnaires that only people who complained actually fulfill the questionnaire. So maybe we received a disproportional response, not from the labs who did not have any problem with the supply chain. And we also have, this is a largely descriptive study, and due to the study design, it was not possible to identify differences between first wave, second, third, whatever. So Javi just now summarized in a few slides what are our opportunities, 3 main opportunities. So first opportunity I see it's mainly for the low-income countries. So you know that we need accurate and rapid, low-cost portable instruments and tests using low-complex, low-cost chemistry. My target actually is to have tests for price less than €1 for HPV screening. And I believe that general innovations around molecular COVID testing actually will produce new tools for HPV, which will come all from recycling of old neglected technologies or with a completely de novo point of care test. So if I show you just one case for the old technology, so this is the isothermal lamp amplification, which is around for 10-15 years, never really used in high frequency in any part of the microbiology, but now it seems that the sensitivity which is required for the COVID will be also equally important for HPV. It's very simple isothermal amplification when you see the product by naked eye. When I speak about innovative product, I put all my money on the CRISP-Cas-based diagnostic assays. As you know, the Emmanuel Chambertier and Jennifer Doudna received the Nobel Prize in Chemistry in 2020 for CRISP-Cas. The method was originally developed for therapeutical reasons, but it seems now, especially Doudna, is focusing mainly on diagnostic part of CRISP-Cas. And when I speak about the potential future, so this is the kind of the assay I would like to see. I mean, short, very innovative electric field-driven microfluidics with very short extraction of the 2 minutes, then lamp amplification, isothermal amplification, and then very quick and very sensitive detection of the amplification products by CRISP-Cas. In 1 or 5 minutes, you have a result. The second opportunity is it's more focused on the high-income countries. So our laboratories are now completely stocked with a fully integrated, high-throughput, automated sample-to-results molecular analysis, which we initially actually put in our laboratories because of the COVID-19 testing. And most probably after the COVID, these machines will experience redundancy. And then it's up to us if we will use all this already installed high-throughput machines also for HPV-based screening. And the third opportunity, so this is the kind of the laboratory I, as WHO expert, visit, and this is the laboratories in which we used for HPV screening or for HIV screening in the non-developing countries. So now I hope, because of the COVID, there will be no such laboratories anymore anywhere in the world. Because of the COVID, there was a significant improvement in the quality of the laboratory space and also quality of the technicians there. And all this laboratory workforce is now completely occupied by COVID-19 testing. I think that the speed of recruitment and the cross-training of the staff to support the organization of the COVID testing will ensure a future larger cohort of the trained laboratory personnel, which then will be also transferable to the general molecular systems, including HPV. So in conclusion, I think that the COVID-19 pandemic is likely to lead to a temporary delay in reaching the cervical cancer elimination targets, but I really trust that with the potential to catch up through the repurposing of equipment, infrastructure, human resources from COVID testing. And it's really our shaped responsibility to make sure that the targets are eventually reached, to remain alerted to the new opportunities that have arisen from the COVID-19 pandemic, and to ensure that are smoothly implemented into the cervical cancer elimination strategy, as well as other fields of medicine, because there are also other researchers in other fields which would like to see this opportunity after the COVID and jump in on all these machines, laboratories, and use technicians. So I hope we as a HPV community, we will actually jump in with HPV-based screening, and we will be able to perform this 1.5 billion tests in the next 5 years. So for the more details, it's freely available paper in PubMed, and you can read all details. Thank you very much.